This is Back in Action. My name is Josh Bunch, and I'm joined by Doctor John Lavelle, spine medicine physician, and Coach Dusty Holden. And we are talking all things related to spine health and getting people back to movement. We are so glad that you are here. Enjoy this episode. Welcome to Back in Action. Josh here with Coach Dusty Holden. Dusty, welcome.
Hey, man.
It's good to see you.
Yeah, good to be here.
We're also with Dr. John Lavelle. Doctor, welcome.
Thank you. I'm excited to be here. This is going to be a fun time.
Yeah, our inaugural kickoff. We've all done podcasts before.
Yeah.
Interestingly enough, we've all been on the same podcast before, and that sort of led us to this, which we have dubbed Back in Action. And today we're going to talk about a few things.
Yep.
We're going to talk about, the obvious, first and foremost, what this podcast is about. That's one of the pieces we want to cover today so that our listeners can tell. Then the second thing is this podcast for them, or specifically who it's for, who it's going to help? What are the takeaways? What are the protocols, if any? And then we're going to talk about our expertise or where we come from, why we think we're well suited for this. That's kind of piece number one. But also, in this world of podcasts, what gives us, why do we think we should talk about this? What do we think that's already missing that we can fill the gap in between something of fitness, the medical world, but I don't want to get too much into it. I want to kick it over and see what you guys have to say and why we're here. And Dusty, I'm going to start with you. What is the Back in Action podcast about?
Well, I think it's for anyone, first and foremost. So it could be for the 30-year-old who maybe was a previous athlete and has been trying to kind of settle into career and life and is wanting to just get moving and kind of rediscover their life, their youth. Or it could be for, the 60-year-old that maybe has been sedentary for most of their life and now they're dealing with some chronic illnesses, pain. Yeah. I think it's just, it doesn't matter really where you are in your journey. I think what we want and what we've discovered is there's a lot of information out there, lots of good information, I think very useful information, but what we want to do is really simplify it down, where it's easy to understand and also give people steps, hey, this is where you can begin and just practical information. And so that wherever they are, we can kind of just come alongside them on the journey and help them just get to a healthier place.
So if there's a vast array of different things they can pull from, and we know from experience, and we're going to talk about that a lot of things will work. What you're saying is we're going to look at this thing and maybe be able to pull out the things that are going to work right now.
Yeah.
Or they can find the signal amidst the noise.
Yes.
Okay.
Yeah.
Okay. Dr. Lavelle, we'll talk about your expertise here in a second, but why are you here, and after hearing what Dusty has to say about it, what is this podcast going to be about? Who's it for?
Well, I think I would reiterate it's for everyone, but having done spine medicine for 15 years, I think like you mentioned, there's just so much noise out there. Mm-hmm. You see it on podcasts, or patients will come in, they read everything on the internet, which I love because I love being challenged with their knowledge. It helps me out, but helping people weed out what they need to know. Through all that noise, people get confused. You listen to these high-level podcasts, and they're talking to maybe 1 or 2% of the population. Yeah. But what does that everyday person need to know? Whether it's the 30-year-old mom with 3 kids at home struggling to get to the gym, what can they do? Or it's the 85-year-old grandpa that can no longer go to their, grandkids' sporting events. What can they do? Most of the time, they have similar issues, but how can they get themselves better so they can do what they want to do and enjoy their life? That's really what I think I want to help get across to people, how they can simplify things, because a lot of it is kind of simple, but it's consistency with those simple things that help people significantly. And I think we've seen that working, the 3 of us together, and I think we can really help our audience understand that.
Let's talk about what you do. So take us through a day with Dr. John Lavelle. Like, who do you see? Maybe what you see most, or why you think that this is a good fit for what you do every day.
Yeah, so every day I'm a spine medicine physician. I work at Tennessee Orthopedic Clinics. We're here in Knoxville. So really trying to work with our community. And I work in an orthopedic group, but I'm a surgeon, so I do all non-orthopedic spine medicine. I'm a physiatrist. Physiatrist focuses on kind of musculoskeletal ailments or neuromusculoskeletal ailments. So looking at the nervous system and musculoskeletal system and how people with injuries or issues within that system start to develop pain. And so that's really my full day, whether it's part of the day seeing patients, really trying to educate them on that problem. And that's the big piece, is the education. That's what in our healthcare model or disease-centered model in today's medicine world, we miss that, education component, really helping develop a relationship with patients and teaching them about what's wrong with them or what's not wrong with them or the misinformation they've heard, and just showing them the track they should be on to try and improve those things.
Do you see everybody? I mean, and by everybody, I mean, do you see every case from
pediatrics all the way up?
All the way up to I can't move?
For sure. I mean, a lot of patients I end up seeing have been to multiple other providers.
Okay.
They come to me as they look online for their last hope, and someone says, try Dr. Lavelle over at, his practice, see if he can help. He has a little different philosophy. But I also see the acute injury, someone on the, football field, a teenager hurt their back making a tackle. So it's kind of this gamut. Anyone that has a spine, I pretty much see, from infants all the way up to, the elderly, and just try to help them keep moving and getting back to what they want to do.
Okay. So Dusty and I are both coaches. We've had a similar experience, but still probably vastly different with everybody. But you're the unicorn.
Yeah, for sure.
Why do you fit into this and what we do with fitness? Or why do you view it as important as I know that you do, and what our listeners will eventually find out after talking? And, how did you hook up with Dusty?
Yeah, I love that question, because I like how you phrase it as a unicorn. Some people call me a quack, because what doctor, spine medicine physician, works with two coaches to get people better? I mean, it's just stupid. No one does that. And that's the comment I get. I mean, I get eye rolls all the time, whether it's my colleagues or when I go give lectures at different universities or conferences, or to my partners in the office. And definitely patients, when I say, well, here's, the treatment plan we're going to work with you. I'm going to send you to these coaches, whether it's in Dusty's CrossFit gym or his Armor gym, and working with you. Yeah. That's kind of intimidating for them to hear. And a lot of times they, initially would be like, he's just telling me to exercise. And that's really where the education component comes in.
I think for most it sounds like too simple.
Right.
100%.
Like for you to say,
right,
just go exercise. It almost maybe comes across as like you just don't have any other answer. So
yeah, 100%.
Just go do this.
And that's the problem, because that's what most physicians, that's what they've heard along the way. A physician comes in, doesn't really develop their rapport with them, just, tells them their quote unquote diagnosis of what they have. And half the time it's, you have back pain. Well, that's not a diagnosis, that's a symptom. So we're not trying to treat that symptom of back pain. We're trying to find out what the diagnosis is. But they'll come in and tell them that you have chronic back pain. Here's a script for physical therapy, and walk out the door. And that's where they throw up their hands. Well, I'm just going to do therapy again. Where working with you guys, it's much different than traditional physical therapy. There's a lot of good physical therapists out there, but you guys kind of take it to that next level and really kind of expand upon what I'm trying to tell them in an office setting while they're in the gym, moving their body, which is their machine to get better.
Sure.
And kind of you just help kind of that continuum of treatment and teach them how to be consistent with it in just a very unique way, with expanding upon your relationship with them. And it just kind of helps me reintroduce that message to them, so they really understand that, when we work closely with each other, they really kind of understand what I'm talking about as they see you teach them about it.
That's really interesting, the way that you say it too, because I've had the honor of working with a lot of athletes that you sent over our way, and they first and foremost say that Dr. Lavelle builds a really good relationship. So they always point to that. And I think another thing that
why does a doctor need to be higher? That's what I never understood in medicine. Why does a doctor always have to look down on the patient? Just sit down, have a conversation, put your hands on the patient, and develop that rapport. But that's been lost in medicine.
That's a great way to look at that. Yeah, that's a great way to look at it. And then that's, that shows us a little bit of the difference of we always want to talk good, and you did, about physical therapists in the group and what they're really there for. But a lot of the job that a physical therapist does, just so our listeners will know, versus what you do and versus what we do, is a lot of it's treat and release.
Yeah.
And that's okay. That may be exactly where they're at. And interestingly enough, I think you would agree, and Dr. Lavelle, you would agree that we would never look at fitness as treat and release. It's a forever and always.
Yeah, there's no end game.
Yeah, there's not. It's not a sales pitch.
Yeah, we're not.
It's a lifestyle. Yeah, they have to continue.
We work out every day.
Yeah.
We plan to work out every day for the rest of our lives. And when people hear exercise, I think that, and maybe rightfully so, exercise is relatively goal-free. There's nothing really that you're going towards. You're just kind of moving, and maybe people see that as kind of odd, and maybe we would too. Just going into the gym and randomly shooting may be okay, but we're going to do something what we would most likely call strength and conditioning, which has a very specific end goal in mind.
Right.
But it's very specific to each and every person that comes in, and maybe that's what you can speak to is, do you see one thing more than another that comes up that you would send for specifically strength and conditioning?
Well, it's mostly the opposite of that, where it's deconditioning. So most spine issues, when people come in with back pain, neck pain, it's they may have imaging already, or maybe I get imaging, but mostly that's not telling the answer. That's not giving the diagnosis, because a lot of patients often think of it as vague, but it's more within how the nervous system is responding. So nervous system deconditioning or desensitization and muscular deconditioning. Because a lot of people, they'll be active the beginning part of their life when they're teenagers, into their 20s, they're working, they're moving, they have kids, but you get that decline as we get older.
So these are when they experience things that aren't really painful as pain.
Correct. Well, yeah, so you could have a disc herniation, you could have arthritis in the back, but that's universal. Everyone does. But
and I could have had it for years.
Most people do. It's rarely a true injury that's causing the problem.
Got it.
So it's kind of helping them understand that something's going on in their life, whether it's, a repetitive activity, something they're doing constantly at work, bending and lifting, or constantly picking up their children, or constantly sitting on a couch as they get older and not moving very much. Or maybe it's an emotional trauma, they're at home, they have, single parent, lots of kids, that comes with a lot of stress, depression.
Yeah.
That can all play into sensitizing that nervous system. So that's a lot more, and almost universally, it's more than just the structural change in their back, because most people have those, that when patients come in, if they have a disc herniation, there's no one I see that doesn't, but why don't all people have pain with that? So there's other systems in our body that are going on and affecting that pain system to cause that pain to be constantly reproduced.
So pain has an experiential, it has an attitude about it, and it has that sort of, like you said, it's far removed from the person. Maybe they were doing one thing 10 years ago that was fine, and all of a sudden, since they've been doing nothing, deconditioned, now that same thing starts to hurt. Yeah. And then that's where Dusty would come in. Correct. So Dusty, when you see somebody like that who's already geared up, who's already in pain, what's the first sort of rapport that you start to build after, Dr. Lavelle has sent them to you? What do you try to do to get them to be okay with moving, or asking them to do things that might be risky, might seem risky?
I think it starts with lowering their level of fear. Most people come in and they're pretty fearful of the thought of moving. So, if you've got some pretty severe back pain, someone telling you to hinge at your hip and try to touch your knee or your mid shin or ankle, that just seems like counterintuitive to maybe what they've been told. Don't do any bending.
Right.
So
there's got to deadlifting.
Yeah, deadlift.
We all want to pick something up.
Yeah.
Okay.
Yeah.
So you're still going to try.
I think the average person hinges at the hip 300 plus times a day.
Okay.
That's the average.
Yeah.
So, I think before you can ever begin to really start to move them and even train them, you have to be able to, one, be sensitive to this heightened level of fear and pain.
Yeah.
So you've got to really build confidence in that, hey, you can do this. So it may start with something very subtle, and then you're looking to just, increase it. And maybe that's today. For example, I had a client yesterday, disc herniation, pretty severe, athlete that you sent. And, the first time I had her to start hinge, she was getting her fingers to the top of her knee. But she was doing that with pretty, low grade pain. So I encouraged her to kind of hinge a little bit lower. By the time we were done, which the session went maybe 30 minutes, mean, she's hinging down, below mid shin.
Just one session.
And I didn't tell her to keep going lower. It's just one of those things that it just started to happen.
She stopped being as fearful as she
could. Yeah, as she could do it and it was okay. She could tolerate it. Then she got the confidence to hinge a little bit more and a little bit more. And so she really didn't even have any awareness that she was doing it. Her spatial awareness, it was very minimal. So me bringing that to her attention, like, wow, look at the increased range of motion in 30 minutes,
But that's the key. I'm not trying to interrupt you, but I am. That's the thing is, when I say deconditioning is people think I'm saying they're lazy. That's not it. But if you go to a traditional clinician, whether it's PT, chiropractor sometimes, physician, they're going to tell you never to hinge at the weight if you have acute disc herniation. You got to just extend, do all extension. Well, that's when you're going to start deconditioning some of your muscles if you're only doing one direction.
Sure.
But if day one, Dusty's trying to condition them to resensitize or desensitize that nervous system that it's okay to bend forward, look at what happens. In 30 minutes, they start feeling better.
So the nervous system is the brain and the spine connected. So what we're trying to do essentially is have them okay with movement that they've been maybe told not to do again.
And really desensitize it.
Yeah.
So it's, overcoming, and I would say the majority of people who are in chronic pain, fear is driving it, and probably has been driving it for some time.
Yeah.
And then, they've gotten diagnosis after diagnosis after diagnosis, and you stack all that on top of it.
Yeah.
And so then you get paralyzed, like to where you've compromised your quality of life, through the information that you've been told. And I think, again, to go back to where we started, that's the purpose of the podcast. It's to really try to quieten down the noise. You can find all the information on the World Wide Web. It's all out there. It's not the information. It's being able to break it down into where it's digestible and that you can take it and put it into action. So I've never had a case with any of his patients where moving them and even with time loading them has increased, their pain, their level of pain. It has always diminished it.
So the more they move into the positions that they may have been told not to move into previously, and the more they load those positions, the better they get.
Yeah.
So it'd be safe to say that the athlete or the person who's going to listen to this podcast is somebody who may have been told never hinge again, never deadlift again, do only extension like you talked about.
Don't squat.
We're going to probably say something very different.
Yeah.
Something they may have never heard before, and it's going to come from a strength and conditioning coach of how long?
15 plus years.
15 plus years. And then how long have you been working with?
I graduated med school in 2008, I mean.
So,
it's been a long time.
That's a long time.
It's kind of scary how long I'm getting old. But let's go back to that fear avoidance, because I think that's the key to focus on. That's what I would say. If you ask what's the most common diagnosis, it's not truly a diagnosis, but a symptom is patients are fearful. When they have the back, they think, because you're dealing with the spine, they think, am I going to be paralyzed? Is this going to be forever? Am I going to develop worsening nerve pain? If it's a degenerative process, it's just going to keep getting worse and worse as I get older, so I'm going to do less and less. And that, unfortunately, is told to them by other physicians and practitioners out there that, you have a disc herniation causing some narrowing. This is just going to get worse with time, but no other explanation. Yeah. So imagine the terror that sets in is like, what does that mean? What is that going to happen? Or you can never bend and do a deadlift. Well, then how are you going to get the dishes out of the sink, pick up your pocketbook, put your shoes and socks on, sit in a chair? We're all hinged right now.
Yeah.
I mean, you can't do any of that. I mean, those are the things that we don't even think about, that people think about in their brain.
Yeah, that's terrible.
So, people have asked me in the past, how long does this process take? When you give advice for people to go move and train or exercise, how long does he see? I would say day one when I leave the door, because when I tell them you can do whatever you want, you're not going to damage yourself. You're not going to injure yourself. Now, this is after I've ruled out maybe that 1 or 2% of people with something dangerous in there, but we're talking about the average, the majority.
Small. Yeah.
When I leave and say, you're safe to move, do what you want and enjoy, use common sense, because you don't want to make yourself miserable if you're in acute pain, but there's nothing you can't do. Their just face brightens up. They're like, this is just the new world for me. It opens things up that, oh man, I do have a path forward. It's not just don't do this, don't do that, and all this terror which is setting in. It's trying to free them of that.
Yeah.
Now, Dusty, and you've been doing this, you said, for about 15 years. So what are some of the things that you're going to start athletes doing? You spoke a little bit about how you got an athlete who couldn't even really touch their knees all the way down to where they're almost touching their toes. What are some of the things that an athlete who may be listening to the podcast could be able to take away from today? So they're not around here. They can't come to you. What would be, again, they're in pain, but they're like Dr. Lavelle said, they're not part of that 1 or 2% who's actually going to do damage. They're part of the other 98% who is fearful.
Yeah.
What's some of the first movements that you may put somebody through, or the first things that you would do with them?
I'd have them lay on the ground on their back.
Okay.
And I'd start with probably some glute bridges.
Okay. What's the purpose of that?
So just a hip extension.
Okay.
And engaging, the glute, the hamstring, where they can start to make some of that mind-muscle connection of like, you feel your glute.
Yeah.
You feel the hamstring. Like,
Yes.
Can you start to feel these certain muscles engaged? And it's in a very controlled, setting. You're lying on the floor. I'm not asking you to move your body through space. It's something that everybody can do it.
Got it. Okay.
I would do some probably just straight leg raises, like unilaterally.
I'm still laying on my back.
Yeah, one at a time.
One at a time. What's the purpose of something like that? And then again, so we talked about PT. A lot of the time they'd be like, oh, I've already done that.
Yeah.
I may have done something like that, but that's not where you're going to start. We're just trying to, or that's not where we're going to stop at. That's where we're starting at.
Yeah.
Okay.
So that would be more just for some mobility, just to kind of see the hamstring tightness.
Yeah.
But also just to kind of get some blood flowing. Because I think that's the important piece, especially for somebody who has really, really restricted themselves down to where they are just sitting.
Yeah.
From there, I may roll them to their side. And now from on their knee and elbow, have them just do some hip touches where they're touching the hip to the floor, but then coming up into, like a controlled side plank, but from the knee. Again, now that's going to involve like QL and a little bit of the low back, but also core. So now you're starting to engage.
These are also things where it's almost impossible not to engage at the midline. You have to make these things happen correctly.
And again, we're on the floor, so now they're starting to move. They're doing some pretty good hinging, and there's some muscle contraction going on, but they probably don't even realize it because it's so controlled, you know?
Yeah.
And now we've at least taken a few steps to where we're moving the body. And you can start to see that like real tense.
You start to calm.
We're lowering the central nervous system just to get them to like breathe a little bit. Hey, relax. Like I'm going to walk you through this. That's the third movement now that we've done. And from there, I may bring them over on hands and knees, quadruped. Could do some bird dogs.
Okay.
Again, just so that they can kind of feel now a little bit of that contralateral muscle contraction. We're involving the upper back now along with the glute and hamstring, the quad. So again, it's just we're starting to get things firing.
And you so far you've said 4 different movements. Okay, so we started with getting on our back, and we're going to do some glute bridge. Then we went to being able to lift the leg. We went
single
to
leg.
Maybe a side plank-ish, a side plank lift from the knees. We went to what could be a bird dog, cat cow, something like that.
Yep.
So you've decided 4 exercises, and none of them sound like voodoo.
Nope.
They sound like something that gets you very comfortable moving so that it takes the anxiety down. So if you're speaking about the athlete you had the other day, it wasn't that she did something that was
groundbreaking, like nothing that she
just made him feel good.
That they've probably never done before.
Yeah.
Like especially if they've went through kind of physical therapy.
Yeah.
Probably exercises that they've been shown, at some point. Now we're just kind of putting it together. And again, it's all the process is just building trust.
Yeah.
Hey, this is how we're going to do it. We're going to really take it nice and slow. Now you've got them relaxed. After that, we could do just some leg raises to the side now to engage the hip, like a fire hydrant.
Okay.
And then probably at that point, I'm going to bring them up to their feet.
And then we start messing
We can start
around
doing with PVC hinging at the hip to kind of simulate the deadlift. And again, all those things is really just, it's building trust, just a one movement at a time.
But not just trust in you, but just trust in movement.
In their body. Hey, you can do this. How you feeling? You know, I check in every now and then. And it's more not because I'm concerned about the level of pain. It's just to let them know, like, hey, do you feel this? Like, you're moving, you're doing the thing, and it's not like getting worse. Your back hasn't locked up on you or anything crazy.
What's amazing though, in those few, let's say that took you 30 minutes to do with them. One, you've built that relationship with them, which kind of expands upon what I'm trying to do with them, is they're realizing they have people that are actually working with them. It's just not someone telling them what to do. So you're one-on-one with the patient. So it's individualized, which is unique. You're not dealing with 6 other clients in a room, bouncing back and forth, just telling them to do an exercise there. You're supporting them. You're calming them, which is not just calming them how they feel, but their nervous system in general. Their heart rate's going down, even though they're moving. You know, you're giving them that support they need, which helps calm down that nervous system, which all feeds back into that, you know, nervous system sensitization, where you're desensitizing it to lower that pain threshold. And you're getting to them to move on day one, instead of just having a little conversation with them, or just saying, we're just going to do this one exercise today for the next, 3-4 weeks. You're already building upon it on day one and giving them that confidence. It's powerful.
Can you tell me, and so for our listeners that I think have already, they really get a good idea of where this podcast is going to go and how it can help. But tell me a really complicated case that you've had, that you've seen success. Obviously, you don't have to give any names. I don't think you're allowed to give any names, but
no names.
Just an idea of somebody who's been complicated that you've seen success by applying or sending them to Dusty and seeing these methods work.
Yeah, what's going to be fun with this podcast is I think we're going to be able to go through so many cases that are complicated, but really break it down to something simple. And that's, as we've talked about, the goal, simplify it for our audience. But I think one case that stands out to me that's always difficult is, oftentimes it's, I'll kind of make up a early 40s, mid 40s. So female that has, kids at home, and we know wives are all been doing the running around, kind of managing the household. That provides a lot of stress. Sometimes, one case I can think in particular is a middle-aged female, got 3 kids at home, husband's in the military, so he's overseas many months at a time. And that gets depressing, sad, you're feeling overwhelmed. And then if you're getting in that age group, you're starting to get premenopausal, so hormones are changing. That affects their mental status, but also how their body's working and functioning. And that just sets them up for having problems and issues with their nervous system. And then maybe they do something one time, they bend forward and their back starts to hurt. And it's often that. It's been building in the background from all these things I just mentioned that are weighing on the nervous system.
But then they're associated with that moment.
Exactly. And they don't have time in their life to be going to the gym because they're acting as a single mom, taking care of their kids. So they don't have time to go train and go to the gym all these hours because they're doing everything else. And so they have that one instance, their back has been deconditioned, their nervous system threshold is lowered, and they feel that pain. So they come into me, usually after seeing other people that have probably tried injections. Hopefully they haven't had surgery yet. And they're wondering, just feeling hopeless. Like, is this my life forever? Where am I going from here? They just don't see any end in sight. And it's just, as we've talked about, breaking it down to them. Well, this is what's going on in your back. You have a little arthritis back there that can cause some back pain, but you have all this other stuff. And everyone has this arthritis, but why in you is that flaring up right now? Or why did that one movement set it off? And just breaking it down from, and it often doesn't happen in one visit. So it's making that rapport with them to kind of delve into their lifestyle. What's going on with their life? What's going on at home? How are they feeling? What do they do that they enjoy? So trying to just start to, open that door a little bit with them, that they can trust me to open up to me and tell me what's going on, and then kind of move them on that path forward. And oftentimes having Dusty work with them, as he just mentioned, he can kind of then reiterate that message to them and start to build that trust. So now they have 2 people they can trust. And we're both men, so a lot of times women don't want to open up about all the different female issues that are going on. But I find that if you build that trust, they're comfortable with that, and they respect you to be able to do that.
So Dusty, off of just hearing what Dr. Lavelle said and off of knowing what you had with an athlete that you were just with the other day for only 30 minutes for the first time ever, give me that same person who's listening to the podcast right now, that Dr. Lavelle just described, which is probably tons of it, and they're 6 months down the road. They've been working with you how many times in a perfect world, and what are they doing?
Yeah, perfect world. We've been training at least 2 times a week.
Twice a week, okay.
6 months down the road.
Yeah, man, we're doing 6 months down the road.
We're doing all the things. I mean, we're like into like full-blown strength training.
Full-blown strength training would mean like I'm picking stuff up off the ground. We can call those barbells.
Yeah, we were using barbells. We're using dumbbells. We're squatting.
So they're not just doing glute bridges anymore 6 months.
No. I mean, we're dynamically moving.
6 months down the road, they're touching barbells.
Yeah,
they're picking stuff up off of the ground.
We're
doing
carrying
stuff that they may have thought they were never going to do.
We're
again.
carrying heavy objects in lots of different positions. We're pressing in lots of planes of movement. Yeah. And so at that point, I think the confidence now there's this level of confidence that they have, that they believe that they can do it. Yeah. They're not broken. And what's happened is their life has changed. They got their life back. Now they've got more energy. They're more motivated to probably parent their kids. They don't hate their spouse for being, overseas.
That's right.
And so I think fitness is unique in that typically like people come looking for it, but what they experience is a lot of other things besides just the physical part. There's this mental aspect, and like for me now to have been training myself, for the last 20 years, physically I feel great. Like I'm pretty content with like where I am physically. It's mentally like every day it's my like reset. Sure, it's as just important as eating. Yeah. I have to do it. And so, and it looks different, it's evolved as time has went on, but I think that's where, people look at it as, well, I'm doing this because I'm in pain or whatever the particular situation is. But then what you notice is like, man, you've just improved every aspect of your life, and now this thing that looked so big is not really that big anymore. Yeah. And you now are like so much more well-rounded as a human being. Yeah. And, it just took you kind of taking control, so to speak, of your life. And it takes discipline. There's a quote that says like everybody's motivated until that alarm clock goes off at 5 a.m. or 6 a.m. That's right. And that's called discipline. At that point, it's like all the fluff of it's gone. Now it's like, all right, it comes down to, making it happen. And it's never easy to get to the gym. Like for whatever reason, psychologically, we are wired to where we think like it's a negotiable. Sure. And you battle that every single day.
It never goes away.
And so it's just one of those things that you have to consciously just keep saying yes to. It's like, I don't feel like doing it. It's not, you can't base it off of an emotion, because that changes every day. And it's based off of who knows how your morning went, your evening, the night before, all those things, I think. And that's where it's really, really important for guys like us just to be consistent, we show up. Yeah. We don't cancel. It's like we got an appointment. You can count that we're going to be there. And I think that's another reason that we have had so much success with it and being able to move the needle for so many people is because, we know how important it is. Yeah. And it's so important that we don't really let anything stand in the way. It's like,
because we do it.
We do it and we know, we believe it. Yeah, like it's not just something we're selling. I don't ever feel like I've had to sell somebody on the idea. I think what I've had to do is really, again, just go back to building the trust that, hey, I need you to really just quieten down like all the noise that you've heard
and read and just trust this. Like, give me a few sessions and I can show you that this is going to change your life, you know?
Yeah.
And so,
what's pretty cool is we haven't really touched on, and you didn't even really mention there, that they're pain-free. That's not the end game. We've talked about movement. We've talked about doing functional activities, you know, having confidence, losing that fear. And I think that's the treatment model we're wanting to portray is we're not saying you're never going to have pain again.
Right.
But we're saying you can be functional. You can do the things you want to enjoy. You can live your life and do everything you need to do. Yeah, maybe you're going to have some aches and pains. Nothing's perfect, especially as we get older. Our body still breaks down, though. Well, there's many ways to fight against that. But you're reinforcing that, you know, be confident. You can do this. You're not going to get injured. You're not going to go backwards. You're going to still be able to move forward and do those things, which I think is pretty unique.
well, and it's not about being perfect, you know, it's not about being pain-free. I'm not pain-free,
Right.
you know,
Right.
You're not pain-free. So, I think getting that out of your mindset too, that, hey, it doesn't have to be perfect. Your squat does not have to be perfect in order for you to be able to perform a squat.
That's
or your deadlift does not have to be perfect in order for you to add weight, you know? It's taking imperfect things, and we can, like, I always look at it as like, hey, this is a long-term game.
Yeah.
We will clean these things up. You know, with time, we will improve your deadlift, or we will improve this position. We don't have to do it all today.
Yeah.
And we don't have to perfect it before we can hand you a weight, you know? It's like, we're going to safely move you.
Yeah.
We're never going to do something that's going to injure you, but at the same time, we're also going to challenge you. We're going to challenge your mindset. And I think that's, again, you know, the podcast is really to, like, encourage people to, I don't care what you've heard. I don't care what you've read. Like, we're going to tell you real life, you know, stories, real life experiences, and there's hundreds of them. You know, we're not talking about a few isolated events. And I mean, the amount of patients that you see, and where you can start to use words like 1%, 2%, you know, it's like when you're talking about a population that 93% of the population is metabolically unhealthy. And then to be able to go and add on that 1 to 2% maybe need like a surgical procedure.
Right. And yet there's so many people in pain.
Yeah. And it's like we're all, you know, kind of sitting around waiting for this, you know, one size fits all kind of scenario. And it really, it doesn't exist. And then, you know, are you thinking that you are this anomaly, you know, that, well, I fall into the, you know, the 1%.
Sure.
And,
well, and to them, to be fair, it is, because they are 100% of themselves. They only know what they're experiencing. And it's scary, especially when you're not given this message. You're just told you have a ruptured disc, a herniated disc, you know, you have spinal stenosis, which is that's all scary terms. And if there's no explanation behind it or talking to them about what this actually means, that's super scary. I mean, a doctor wouldn't go in and say, you have, you know, lung cancer. Bye. You would explain why that is, what's going on. And that's the same thing we don't see with back pain. It's, you have back pain, you have this disc herniation.
There's no solution.
There you go. I mean, we can try an injection or take some opioids or go see physical therapy. If you're not better, you know, there's not much more I can do. I mean, that's just bullshit. There's so much more that can be done.
Yeah.
And it's really that education piece that's lacking. And I think that's what we're going to bring to people.
That's the message.
Yeah.
Gentlemen, I'm going to cut us off there. I think that gives plenty of where the audience can click in, see what they're going to get for future podcasts, see what we're going to dive into. It's going to be a lot, and hopefully everybody subscribes and jumps along for the ride.
It's going to be fun.
Thank you very much. I appreciate it.
Good job, guys.
Thank you.
Thank you for watching. Join us for much more where that came from. And when you get a chance, follow us on Instagram and YouTube at Back in Action Podcast.